Content and goals. The way we plan and build our cities defines our quality of life. It affects not only the quality of our living spaces and transport, but also of the air we breathe, the water we drink, as well as our access to nutritious food, education, healthcare services, and employment. Over time, trends have shown that spatial factors actively contribute to health inequities. These are reflected in the unequal distribution of health risk in relation to geographical location. Inequity in health is a specific kind of difference in health that is systematic, unfair, and socially produced, and therefore modifiable. Urban and territorial planning can be defined as a decision-making process aimed at realizing economical, social, cultural, and environmental goals through the development of spatial strategies and the application of institutional and participatory tools. This process influences how we use and access all forms of urban development, which are directly connected to health outcomes and health equity. Urban and territorial planning affects people's health. A global assessment of the burden of disease from environmental risks clearly indicates the role of the built environment in health, underscoring why we need to harness urban and territorial planning in the service of health. Physical health, mental health, and health equity are three key elements concerning the input and outcome in urban design and territorial planning. One of the main challenges in urban and territorial planning today is to ensure that leaders have the knowledge and guidance to integrate health and well-being into their planning process. The Guidelines on Urban and Territorial Planning (IGUTP) are a set of universal planning principles for the improvement of planning and management at all levels. Notably, these guidelines are approved by the UN Habitat Governing Council in 2015 and advocate for urban and territorial planning as an integrated and participatory decision-making process to plan and manage our cities and territories in a holistic manner. Urban and territorial planning can cooperate with the public health system to ensure good health promotion, disease prevention, and better health equity, to improve the management and reduction of communicable and non-communicable diseases, and to support the targets in Sustainable Development Goal 11. The common goal of health can be pursued by improving access to healthcare, tackling the spatial and environmental causes of illness, raising the level of health literacy, ensuring that health outcomes are part of the training for all built environment specialists, ensuring that urban territorial planning includes awareness of climate change and the environment, and by helping to deliver national health plans. The most important asset of any city is the health of its people. Accordingly, the urban territorial planning process should focus on fostering the expertise of healthcare professionals, bringing on board new partners, integrating with the climate change agenda, setting health and well-being as inspiration, highlighting the links between health and urban territorial planning, advocating for healthier urban territorial planning, and influencing evidence-informed decisions. A health-driven approach can offer better coordination of efforts towards the achievement of the Sustainable Development Goal 3, the health goal. The Guidelines on Urban and Territorial Planning aim to foster sustainable urban and territorial development through 5 qualifiers. Health as a role in each one of these qualifiers as an outcome by means of supporting active mobility, public transport, and social interactions to reduce the use of energy and resources. Supporting the well-being and resilience of vulnerable subpopulation, reducing inequalities, and ensuring adequate access to health. Facilitating better health through access to economic opportunities, amenities, and services. Designing health benefits into nature-based solutions for ecosystem service, climate mitigation, and resilience. And finally, better integration of evaluation of health impacts of urban environment interventions with the planning system. The guidelines on urban and territorial planning aim to foster sustainable urban and territorial development through five qualifiers. Health has a role in each one of these qualifiers, also as an input by means of planning more compact places, planning more socially inclusive places, planning better connected places, planning places that are more resilient to climate change and natural disaster, and championing more institutionally integrated planning. All the factors listed below are to be taken into account when identifying or mapping the areas at greatest risk in terms of exposure to urban health impact UHI. Among the geographical factors, the Normalized Difference Vegetation Index NDVI is an indicator of greenness in the biomes, while among the demographic factors, population density refers to the number of human inhabitants per square kilometer. The results of the Normalized Difference Vegetation Index (NDVI) calculation range from -1 to 1. Negative values correspond to areas with water surface, man-made structures, rocks, clouds, and snow. Bare soil usually falls within 0.1-0.2 range. Plants will always have positive values between 0.2 and 1. Healthy, dense vegetation canopy should be above 0.5, while sparse vegetation will most likely fall within 0.2 to 0.5. However, one should always take into account the season, type of plant, and regional peculiarities to truly understand the meaning of NDVI values. Here are more descriptors of some morphological characteristics such as resident population, altitude, percentage of area with high population density, percentage of presence of water, percentage of public green areas, railway density, high-speed roads density, which refers to freeways with limited access and ramps for entry and exit that provide free-flowing, high-speed traffic flow over long distances, and density of other roads, which reflects the intensity of vehicles on the road. Regarding the distribution of the population by average summer temperature, May to September, the temperature factor maximum-minimum must be taken into account. With regard to the population percentage, it may be useful to consider the distribution, e.g., the 25th percentile, meaning that 25% of the data falls below the first quartile, the median, meaning that 50% of the data falls below the second quartile, and the upper quartile, meaning that 27% of the data falls below the third quartile. For the purpose of air quality regulations concerning outdoor environmental polluters, the airborne particulate matter (PM) are defined by their diameter. Those with a diameter of 10 microns or less, PM10, and those with a diameter of 2.5 microns or less, PM2.5, are inhalable into the lungs and can induce adverse health effects. For these outdoor environmental pollution factors as well, it is important to take into account that percentage of the population exposed, e.g., the 25th percentile, meaning that 25% of the data falls below the first quartile, the median, meaning that 50% of the data falls below the second quartile, and the upper quartile, meaning that 75% of the data falls below the third quartile. A link between environmental degradation in cities and health inequity means that the most severe environmental health impacts fall on lower income households and those already vulnerable to other deprivations. The Index of Living Environment Deprivation measures 7 domains to determine the quality of an individual's immediate surroundings, using indicators which fall into two subdomains: the indoors living environment, which measures the quality of housing, and the outdoors living environment, which contains two measures relating to air quality and road traffic accidents. All of the recommendations listed so far have implications for adopting equitable approaches within the urban and territorial planning. Let's review. Addressing land-based rights in spatial strategies. Accepting health equity audit on all planning policies. Designing environments to offer a wide variety of opportunities for economic development, decent work, and strengthen communities. Other recommendations are protecting the natural environment, mitigating climate change, and respecting the relationship with the environment. developing child-friendly and age-friendly spatial policies at city, neighborhood, and building scale, and developing and enforcing good environmental and building standards and codes.